Hello, everyone, and welcome back to Age Wisely Atlanta with your favorite senior housing specialist and realtor, Sonya Peterson, where I bring you the latest and most valuable information for seniors and their families. Today, we have a very special guest, someone who is truly dedicated to making the complexities of Medicare easier for all of us to understand. Joining us today is Elli Jolly, a health and life insurance and benefits advisor who proudly calls herself a Medicare Guide. Elli is licensed in Georgia, Alabama, Florida, and Ohio, and her mission is to make Medicare easier for everyone. So, Elli, thank you so much for being here today. And you can start off by telling us a little bit about your background and what drives your passion for helping people navigate Medicare.
Sure. Well, thank you for having me. First of all, thanks for inviting me to join you. I'm honored and happy to be here. And actually, I had a corporate gig. I was in the corporate world, and a few years ago, my mom, we got a scary diagnosis. She does have cancer, and I got a little more involved in her coverage, right? And at some point I was like, I had already decided to go get an insurance license because the corporate world and the field I was in was kind of looking a little scary. It was looking a little sketchy, like this might be coming to an end. So I'd already on the side went and got an insurance license, but not the health license. And when we started going through all this with my mom, as a matter of fact, I had to cancel my health and life exam in Georgia to go up for some more tests and things for her up when she was living in Ohio. She's here now, and we're a few years down the road, and we're stable. And here I am, licensed and doing Medicare. She was my first client, and it, like I think, kind of started off with, I'm going to get my insurance license because I think my corporate career is looking a little sketchy. And then mom got sick, or we found out that she was sick, I should say. We got her diagnosis. And then I was like, I think I should, I'd like to be able to talk to her insurance company. I won't say which one it is. They've been great. But the agent that was working with her, I was like, why are we not getting answers? We need to know this. I need to know that. And so anyway, and I said, well, I'm just going to get the license. How hard could it be? So I did get it. I passed that exam on the first try. But when you've worked in the corporate world and you're going through a class and you're talking about HMOs and PPOs and all the different things involved, it kind of makes sense, or at least it did for me, right? But that's where the passion comes from, is because it's so unnecessarily confusing. And I meet people every day that say, they're stressed out. They're trying to figure it out. They're coming up on their 65th birthday. They have all this pressure. And then I'm afraid, I hate to say this, but there are people in my industry, whether they're really licensed or they're not really licensed, which is a topic for another day that we should talk about, if they're really allowed to be selling insurance or if they're not, because there are a lot of scams, and there's so much telemarketing around this Medicare thing, right? And there's so much mail, and people are bombarded, and there's TV ads, right? And Medicare changes the rules every year, and they're trying to protect the beneficiaries. But man, there's still so much. So there's so many people in my business that are adding to the pressure, right? I had a lady last week that came in, so confusing, getting so much different conflicting information from different sources. And I was like, let's look at numbers. Let's look at some facts. Let's look at data. Let's do that. And by the way, you don't have to make a decision right now. If you're not turning 65 for a few months, we've got a minute, right? This particular person had doctor appointments coming up. There could be something scary. There was something she was worried about. I said, we've got time to do this. You need to focus on yourself right now. I won't let you miss the deadline. We got it. Right. But there's just so much unnecessary confusion and people looking to make a quick buck, right, and move on. And that is just, to me, and I know that's to you, this is not the way we do this, right? Everyone needs to kind of be helped and walked through the process. And so I love to be a Medicare guide, right? Because it is unnecessarily confusing and difficult. And so, and it's funny because you would think I would start doing some other insurance, and I have not yet.
Wow.
I can. There's just there's a lot to keep up with Medicare, and I'm very involved with my clients. You know, like when there's an appeal, like I know you asked me about, we'll cover that another day, but I want to know about it, and I want to see if I can help, right? And so, you know, it's a long-term relationship. It's a friendship, and to me, this is more advocacy for the people that I work with and serve than just a business, right? So it's almost a purpose and a mission.
Well, Ellie, and I know exactly what you mean about so much confusion. My mom, she just refuses to answer her phone. But now I know that there are like parts A, B, C, D, E, F, G. So why don't you tell us about the different parts of Medicare?
That's good. That's good. All right. I'm going to give y'all a quick, and you know, I know you'll put my contact information up. I've got a one pager that is my cheat sheet that I love to give people. Okay. First thing you got to know is, so when you're 64, and you're just starting to think about Medicare, there are some important things you need to know and some things you need to plan for. Okay. First of all, you've been paying a FICA tax at work all these years, right? This is where this is going, is Medicare, but it doesn't cover every part of Medicare. You just said yourself, like everybody knows there's more to it than one part. So the FICA tax that we've been paying for all our career, it is only covering one part of Medicare, Part A. All right. So A, that's your hospitalization. All right, great. How often do you go to the hospital? I mean, really, if that's your hospitalization, God forbid you should ever need hospice. That's what's going to cover it. And home health care, like skilled nursing, I should say. Let me say it that way, skilled nursing in a Medicare approved facility, right? Medicare approved providers, skilled nursing. So that's it. So now you ask, but wait a minute. What about seeing doctors and stuff like that? What about prescriptions? Glad you asked. We got more parts to cover. Okay. So that's Part A. You have paid for that. I never say it's free. You've been paying for it your whole career. If you've been a W-2 employee anywhere, you've been paying for that. There are ways that people who haven't worked be required about 10 years paying into the system for 40 quarters. There are ways for those people to actually pay for Part A, but most people have paid in, and they can get it at 65. There are exceptions to everything. It's the government, right? This is federal health insurance. So there's always exceptions, right? There's a lot to it, but generally. And then there's Part B. Now you want to see a doctor, right? All right. So they came out with Part B. Part B is where you're going to get to see a doctor. You're going to get to have treatments, injections, insulin, by the way, even though they don't consider that like it's kind of iffy, but Part B covers your insulin injections, like knee injections, things like that. And also doctor visits, durable medical equipment. What that is like if you need a wheelchair or hospital bed, Part B is going to cover that. It's got to be a supplier that takes Medicare's payment, but Part B is going to cover those things. Here's the catch. Now, what I didn't say about Part A is you've paid for it. So there's no premium if you've worked 40 quarters in 10 years, right? There is a deductible, and it is not a once a year deductible like you're used to. It's one this year, and it'll probably go up next year. It's $1,632 is the deductible should you get admitted to the hospital. Okay, not one time. You get a 90-day benefit period. So God forbid you stay in the hospital for a long time. Whatever, you pay $1,632 for the benefit period, which is 90 days. You have a bad year. You got to go back in the hospital. It's been 6 months since you were in. What do you pay this time? $1,632 again. So that's the challenge with Part A. Okay, you don't pay premium if you've worked and paid into your FICA, but you do have to pay that deductible. Now, Part B is not free. This year, it's $174.70 a month. That's not too bad when you've been paying for group insurance at work. It's not bad. Here's what you need to know. It's an 80-20 split. So it covers 80% of the cost of those things we talked about, the doctor visits and treatments and durable medical equipment and things like that. 80%. You pay 20%. If you have chemotherapy, I know insurance agents, we use this all the time, but my mom has cancer. If you were paying for chemotherapy and it was $100,000, let's say, and that's a deal, you're paying $20,000 under Part B, which is why we have additional coverage that insurance agents can talk to you about, right? This is where we get into Part C, and this is where people get really confused. This is the product that you see advertised on TV, where years ago when celebrity endorsements were allowed, which they're not, that's when you saw Joe Namath talking about Medicare Advantage, right? Medicare Advantage is Part C. So several years back, they decided that to allow private insurance companies to come in and help with this, right? So this is where you have Humana, Aetna, United Healthcare, Anthem, Blue Cross in Georgia, all these companies stepping in. What happens is they take over for Medicare. So you had your Medicare A and your Medicare B. Now the private insurance company is going to step in and take that over for you. So you don't take your Medicare card to the doctor anymore. You take your Humana card. They have taken it over. So your Medicare now is being handled and done by the private insurance company. So it's kind of like you have original Medicare A and B, or you can get the private insurance. Now, why would you do that? Because the private insurance companies are going to add in things that Medicare doesn't cover, like hearing, dental, vision. If you're used to having that at work when you're retired, you might want that. If you have original Medicare, you don't, those things they're not included. You're going to buy that stuff separately. Okay. The thing we didn't talk about was Part D, which is D for drugs. D is prescriptions. That also was added a few years back now. That was added as another part of Medicare. Because you got to get your prescriptions covered somehow. Well, guess what? Those private insurance companies, they wrap that in too. So a lot of the Part C Medicare Advantage plans, they'll have hearing, dental, vision, and drug coverage. Okay. So that's what makes those attractive. I actually sat down with a friend the other day that does insurance billing, and she was telling, she wanted me to talk to someone. And I said, she was all about stay with original Medicare. And I said, now listen, this is how I make my living, right? And I have to paint the whole picture for him. I got to explain to him, look, 20%, you got to pay 20% under original Medicare. You got a deductible of $1,632 every benefit period on your Part A. You do not have drug coverage. You have to buy it. And I can help you buy it. But when you buy drug coverage by itself, it's not always super cheap, right? So, and if you want dental coverage, we have to find you some. You've got to buy that too. Okay. So it all becomes piecemeal. So it can become expensive. And she had to admit when we went through just one of the Advantage plans, I said, I know that I can see your side, that for a provider, billing directly to Medicare is easier. But for people, right, this offers them so many more benefits. It makes their lives easier. And this is more affordable. I mean, it just is, right? One more part of Medicare we didn't talk about. All right. So those are the 4 parts. There's 4 parts: A, B, C, which is Advantage plans. Those take over for A and B, and D, drug plan. You can get it through an Advantage plan, or you can buy it separate with your original Medicare A and B. One thing we didn't talk about, you're going to hear a lot of talk of Medicaps. What the heck is a Medigap? It's just like it sounds. It's extra insurance that you buy, kind of like an umbrella policy on your home and auto. Think of it like that. It's like an umbrella that goes over original Medicare A and B. So you got your A and B, and you don't want, let's say you don't want a Part C plan. You don't want to do that. You want original Medicare. Okay. We get you a Medigap, or it's also called a Medicare supplement plan, to be the umbrella over that. So that 20% that we talked about that, people should be a little bit concerned about, the Medigap covers that. Now those, whereas the Part C plans this year, a lot of them have a 0 premium. Okay. You have to have Part A and B. B you have to pay for, remember. But a lot of these Part C plans have 0 premiums. Not all, but a lot do. So you can see why that can be really attractive. You get a lot of benefits and you don't have to pay extra. But you do pay copays as you go. Now with the supplement or Medigap, you buy that insurance. It's like life insurance. Matter of fact, when you're 65, you got a 7-month window where you can get it without underwriting, which is great. But after that, you're going through underwriting just like life insurance. Okay. Matter of fact, a lot of the life insurance companies offer it, but it's not cheap. We talked about zero premiums over here on the Medicare Advantage side with your Humanas and your Aetnas and all those guys. Over here on the Medigap side, gosh, I mean, in my zip code, a woman, maybe $135 a month, $140 a month is the best rate for a plan G. A man is going to pay 145-ish at 65. Okay. When they are guaranteed issue and they're in that first initial enrollment window, that's going to be, then they're going to take a premium. They're going to take a rate increase every year. Okay. Mm-hmm. So that is like, all right, I'm prepaying for my medical expenses. It's set forever. I'm locked in. I know there's going to be a rate increase every year. It's going to happen. Believe me, it's going to happen. One of the carriers just did a 13% increase, which is really high. We like to see those stay below 8%, and we've seen 10% and 13% this year. So those go up every year, but you're kind of like prepaying for your medical expenses, whereas on the Advantage plan, you pay copays. So you pay as you go. So it's two different ones.
Well, let me ask you a question about the Medigap. So I understand. So will it cover that 1632 hospital stay that you mentioned when we talked about Part A? If you go to the hospital, it's 90 days. And then if you go back in 6 more months. So will it cover that if you go to the hospital, let's say 3 times? So that could be a benefit, especially if you're someone that, is in and out of the hospital.
That's exactly right. So there are nationally standardized plans on the Medigap side. Like you were like A, B, C, D, E, F, G. And I laugh because we got a G plan. We got an M plan. There used to be a C and an F plan. Those are not, I can't sell those people that turn 65 after 2020 or whatever. I mean, but they're nationally standardized, so those, like a plan G is a plan G everywhere. Same benefits. No, pricing could be a little different, right? But same benefits. So yes, to answer your question, it does. It does. So when someone has they turn 65 and they already have some medical challenges, I'm probably going to talk to them about a supplement, and if they can afford that, and if they can afford it for the long haul and keep it forever, right? Because then your coverage you're set, you're covered. Mm-hmm. But you got to have A and B to get one of those too. Same requirement. And the one thing I wanted to mention, because I had someone get hit with this today, and I don't want to forget to mention that we said Part B has a premium. $174.70 is the standard premium. If you had a good year, there is a 2-year look back. This is government insurance, guys. There is a 2-year look back. Okay. If you had a really good year 2 years ago, and on your tax return, your modified adjusted gross income was, over, like the number this year is $103,000 filing single, $206,000 filing married. If you're over that, your Part B premium is not going to be $174.70. You're going to get hit with, I hate to call it this, but it's kind of a success tax, right? It's an IRMA, and she's not your friend. Your friend IRMA is not super friendly. She's going to hit you with a Part B and a Part D penalty. So that's something to be aware of. Like you want to budget for that.
So how much is that penalty? Is it a standard number or is it a percentage?
Mm-hmm. So I'm looking at the chart right now. As a matter of fact, the number changes. It may change every year, but it's kind of like it's standard. There's a chart. I mean, if you're within 103 to 129, 206 to 258 married 2 years ago, these are your 22 taxes. They can't find 22 taxes, so go to 21 this year. Your Part B premium would be $244.60 instead of $174.70. Mm-hmm. If you have Medicare Advantage or you bought a Part D plan, they're going to charge you $12.90 at that point for a Part D plan. So, and those numbers it goes up. It goes up. If somebody had an exceptional year, I mean, I can't even imagine this, but if somebody makes more than $750,000, what they reported 2 years ago is their MAGI, right? Their premium is now $594 every month. The other thing is that when you are approaching Medicare, while you can, if you have you're not collecting your Social Security and you're still working, you're not taking your Social Security, you're not on disability, right? And you're still working, but you decide you want to get on Medicare. As you're approaching 65, you at least want to go ahead and get your Part A because again, you're entitled to it. You've paid for it already. Okay. So you want to at least get that. And you can do that by going to SSA.gov. Social Security is who manages this, right? So you apply through Social Security. You can do it on their website. You can go in person. I wouldn't do that. You can do it on the website. It's very good. And they'll send you the cards, but you have a choice to make about whether or not you want to take Part B. So we talked about the costs and the IRMA and all of that. If you have credible coverage, like you're covered at work, and they're not going to kick you off the plan at 65. Sometimes they do. Okay. Sometimes they do. And if they're not going to, you should really weigh it, whether or not are you better off with Part B or are you better off with the group coverage? You can have Medicare and group coverage. Technically, you can. And there's an order, as to who pays first and who pays second. And people that have group coverage and Medicare, I mean, that's really good insurance, to be honest. Right. It's really good. Now you've got two payers. But, so if you can stay on the group coverage and you're happy with it, you just want to consider because Part B is not free. It's $174.70 a month. We talked about the 80-20 split. There's also a $240 a year deductible. Now you asked about Medicaps. That's one of the things with the Medicaps. Now they will take care of that Part A deductible, but not the Part B, the 240. Mm-hmm. And the benefits of the different Medigap plans, like I say, they're standardized across the country. This is where they vary, right? Like a Plan N might be a little cheaper every month, just a little, but you have co-pays when you go to the doctor on that, even though it's a supplement. It's kind of funny, right? Mm-hmm.
And you hit on where I was getting ready to go. So for people who are approaching 65, what do they need to do? How can people prepare?
Well, I muted, okay. There's a few things. So like I said about the money, right? Know that if you are not on disability and you are not collecting Social Security, you need to go online, ssa.gov, and apply for your Part A, okay? You can do it 3 months before your birth month. You've got a 7-month enrollment window here to work with. So there's time. You can do it early. Just go ahead and do it early. Like I say, 3 months before your birth month, you can go online and do that. They'll need a little bit of information. They are going to want to know about things like your current coverage to determine if it's credible, right? And then, like I say, you have to decide about Part B. Do I want to take it now or do I want to wait? If you've got group coverage at work, they would consider that credible. And you could wait. You don't have to take it. If you're on COBRA, not credible. And here's what happens. If you don't have credible coverage that they consider credible coverage and you decide to not take the Part B, there's a penalty for that too. 10% forever. Okay. There's also a late enrollment penalty on the Part D drug plans. So that's only 1%, but still these enrollment penalties, you got 63 days when you lose your coverage that they consider to be credible. You got 63 days to get this worked out, right? So if you lose the coverage, you want to grab your Part B and Part D. Both of them have penalties if you don't.
Wow. So, Elli, I mean, this is like an onion. It's just like layers and layers and layers. And just as we continue to talk, one of the things I want to do is for us to come back, because I know that we have really only scratched the surface. And I'm sure that the people that are listening, their head is already like, because I know mine is. So tell me, how can people reach you? Because really, we know that none of this is a one size fits all, and you're giving us, standard information. But if someone really wanted to contact you and have you look at them as an individual, how can they get in touch with you?
Yeah, my email, if you want to email me, is Elli, ELLI, at ejolly, EJOLLY.agency. And also, I was just looking for it. I have an office number. You can also call me. There, it's 470-315-0810. That's 470-315-0810 is my office number. And I have a Facebook page, believe it or not. It is a business page. You would have to search for it that way, I guess. And it's Elli Jolly Health Agent. So if you want to follow me there, I try to post interesting things about senior scams, Medicare scams, staying safe, rules of engagement here, and obviously Medicare. So, and as I mentioned, I have this one pager about everything that we talked about. I've got in a one pager for folks that are wanting to understand more about Medicare. I'll be glad to share it.
And one thing I will do, because you did send me a copy of your one pager, I'll also add that as an attachment in the YouTube description, so that anyone that wants to get that, they'll be able to just download it. So I know one thing you did mention, and was the Medicare assignment. Did we cover that? I think you mentioned wanting to go over that, but I don't think we covered it.
We did not, and I don't want to dilute and make this more confusing than it is already. So if someone has original Medicare, A and B, right? Or if they have original Medicare and they buy the Medigap or the supplement policy to put over that, like an umbrella, right? They want to make sure that the doctors they see are participating with Medicare. So that's first. Second thing about that is they want to ask, are you accepting assignment? So assignment is kind of what you probably think it is. If you're contracted with Medicare, and I think that we're getting to the time of year this fall where when they do that every year, when the providers contract with Medicare, they agree to accept like a certain amount of money for different things that they do, right? So that's what accepting assignment means. Now, if they are not technically contracted with Medicare, they can see you and they can bill Medicare. This is something to be aware of, that those doctors are allowed to charge you up to 15% over the assignment rate. Okay. So I always tell people when they get a supplement, I'm like, now the only thing you got to do, you don't have to worry about a network. It's not a PPO, right? This is different kind of insurance. You don't have to worry about that. All you got to worry about is, do they take Medicare? Well, they bill Medicare for me. Great. Then they have to take the supplement. It doesn't matter who it's with. Doesn't matter. They got to take it. But then the next question is, do you accept assignment? Which means, will you take the amount Medicare reimburses you for that they've already contracted you to take, or are you one of those people that's going to bill me the 15% more? It matters because, like in the supplement world, some of those plans, Plan N is one of those, they don't cover excess charges. So that's why it matters. I tell people, like, if you're going to save a little money, you get the Plan N, you just really got to ask that question, or be prepared to pay. They are allowed to charge, up to 15% more. So something to be aware of.
That is good to know, because most people, I'm sure, have no clue about that until, what is it, the saying, it's good until it isn't. So until it happens. So well, Elli, like I said, this has been great. I thank you so much for joining us, and I will put your contact information in the description of the video. And for anyone that comes back and watches this later on, if you've got questions, you can put those in the chat, and we'll make sure that Elli gets to respond, because she is the expert and not me. So we appreciate you tuning in, and we'll see you soon for another episode of Being the Guide to Medicare.